Many people have their onsets when they're using drugs, so it's not clear if it's a toxic psychosis or it's schizophrenia. When a person develops schizophrenia, and oftentimes when their symptoms first emerge, it's not clear that that's definitively the diagnosis, because the symptoms may be not clearly expressed or may be intermingled with other things that are going on. For example, many people have their onsets when they're using drugs, so it's not clear if it's a toxic psychosis or it's schizophrenia. However, sort of whatever the circumstances of the initial phase of the illness, and the illness does not begin abruptly usually from one day to the next. It's usually something which occurs iteratively or gradually over a period of weeks, months. But when it occurs, most people and their families, because usually they're in families at that time, don't really have any awareness of what's going on. I mean, if you have pain in your stomach or nausea or diarrhea, if you have chest pain, if you have trouble breathing, people have a sense of, well, I have a problem with my heart, my lungs, my stomach, my kidneys, I got to go see a doctor. When people develop these problems, they don't necessarily know what's going on, and they don't necessarily know what to do. So they're pretty blindsided. Then when they get treated, assuming they get treated, and that's not always the case, at least readily, and they get better, and they feel, oh, I don't know what that was, but that's over and done with, I'm going to get back to, but what they don't appreciate is the fact that the illness is really a recurrent and lifelong illness.